Are you ready to simplify your workflow and deliver better patient care? Let's look at expEDIum Office EHR, a secure cloud-based solution meticulously designed for gastroenterologists. It leverages over a decade of our expertise in providing RCM products and services and has processed millions of claims tailored to their unique clinical needs. In this video, we will show you how it can transform your practice. Meet Jane, our front office admin. She begins her day by securely logging into the expEDIum Office EHR. The system's secure two-factor authentication received over an email or cell phone ensures that sensitive data remains protected with additional security, enabling staff to access patient records securely over a standard internet browser. After logging in, she accesses the customizable dashboard. For Jane, it highlights upcoming appointments, patient visits, documents, her tasks for the day, and journal entries. Each team member, whether a nurse, biller, or office manager, sees a dashboard tailored to their role, ensuring easy navigation and efficient workflow. Jane receives a call from Mr. Adams to schedule an appointment. Using the intuitive appointments module, she checks the day's schedule and books his slot. Whether scheduling for new or follow-up patients, the color-coded view helps her efficiently manage appointments across multiple doctors and facilities, keeping the clinic organized. To ensure patients never miss a follow-up, the system also integrates with USA Notify to automatically send appointments and recall, follow-up reminders via email, text, or phone calls. Clinics may still choose to call patients directly, but these reminders help reduce missed appointments, save staff time, and reduce the cost of no-shows. During a call with Mr. Adams, Jane also collects his demographic and insurance information and enters it into this section. She then adds the call log as a journal entry for future reference. Jane then verifies Mr. Adams' insurance eligibility prior to the clinic visit. Seamlessly integrated with expEDIum medical billing software, this process is streamlined and secure, helping the clinic manage to bill more efficiently. To speed things up further, clinics can add favorite payers for quick access and even set up global payers across the system. These features simplify billing operations and minimize repetitive administrative steps. Once Mr. Adams comes in for a consultation, Jane collects his insurance card and lab results, and uses the integrated scanner feature to digitize these records. She selects the scanner from a drop-down, scans the documents, and uploads them under the right categories in the document manager, keeping everything organized, secure, and accessible, eliminating the need for local storage. Next, Sarah, the nurse, prepares for Mr. Adams' consultation. She reviews his existing information and records details such as social history, surgical history, medications, allergies, problem lists, and family history. The prior note feature automatically prepopulates data from Mr. Adams' previous visit note into the new visit note. This means Sarah doesn't have to manually re-enter information, she reviews, verifies, and updates any changes. The feature ensures accuracy, continuity and significant time savings during consultations and follow-up visits. Dr. Roy, the physician, begins the consultation by reviewing Mr. Adams' prepopulated medical history in the visit note. To streamline his documentation, he uses the built-in dictionary management feature selecting from customizable short and long text templates tailored to the clinic's vocabulary. With a simple setup through email-based sign-up, Dr. Roy quickly accesses ChartNote and begins dictating his findings using the integrated AI speech-to-text tool. It captures clinical narratives in real time, minimizing typing and allowing him to stay focused on patient care. After assessing Mr. Adams, Dr. Roy prescribes medications using the seamlessly integrated Ensora HealthyRx and EPCS system, which is Drummond certified. He also documents the diagnosis and procedure codes and schedules a follow-up visit if necessary. This information will be used when submitting MIPS reports. The eFax feature, integrated through SRFax, enables providers to securely send and receive documents such as patient documents, patient summary, visit report, e-prescription receipts and referral letter. The system includes built-in MIPS advisory tools that help providers manage performance reporting easily. Instead of manually adding or removing measures each year, practices can review, update and stay aligned with the latest requirements without added administrative burden. Before leaving, Mr. Adams receives a summary of his visit, including prescriptions, follow-up instructions and relevant patient education resources. The team creates an electronic super bill in the billing office based on Mr. Adams' visit note. The seamless integration with expEDIum medical billing, EMB, software streamlines claim generation, enables automatic electronic claim submission, and ensures smooth cash flow and reimbursements. The effortless login from EHR to EMB further enhances medical billing workflow efficiency. With automated ESB feature and tight integration with our RCM product and services, we can achieve a first-pass claim rate in the 90th percentile. Next, using the patient ledger from expEDIum medical billing software, the billing team tracks all payments and charges, ensuring clear and accurate financial records, including capturing copays and tracking current patient balances. Task management is simplified with expEDIum Office EHR. The color-coded system helps the team prioritize tasks efficiently, ensuring clinic operations run smoothly daily. Also, the built-in messaging system allows staff to communicate securely within the EHR. Whether it's a quick update, clarification, or task follow-up, messages are delivered in real time, reducing delays and improving coordination across the clinic. Tom, the clinic administrator, tailors the EHR to the clinic's specific needs with the help of expEDIum's implementation and support team. From creating user roles to setting up custom fields, the system adapts seamlessly to different workflows, ensuring each staff member can perform their role effectively. The EHR's self-service visit layout customization empowers practice administrators to wire new layouts independently without vendor intervention. Following performance insights, the team can use the patient recall feature to identify and reach out to patients due for future visits like annual checkups or follow-ups scheduled next year, helping improve retention and continuity of care. Need help? The help section provides detailed guides and FAQs, ensuring that all users, whether at the front desk, nurse's station, or billing office, can easily find answers to their questions. For additional support, click the expEDIum Navi icon to chat with support for help with navigation, features, or technical issues. The product's intuitive design also includes easy navigation and an app drawer. It features a quick search option to open the patient chart, provides direct access to tasks and notifications from any screen, providing a smooth workflow. Developed with user feedback and refined through extensive testing, the user interface design system supports every aspect of small to medium-sized clinic management. And we're just getting started. Several enhancements, including document staging, MIPS dashboard, patient portal, and more are already in our product backlog. We are also actively pursuing some AI use cases that would bring predictive capabilities to the EHR product. Stay tuned as we continue to expand the platform's capabilities. Experience the all-new expEDIum Office EHR, which is now live. Visit our website to sign up, learn more, and stay updated on the latest developments. Reach out to us at contactus@expedium.net or call 786-646-0099.